Even before I start, we've got a saying up in our neck of the woods that when you speak, if you don't introduce your wife, you have to buy her a new dress. So I like for my wife, Jamie, to stand, if she would, please. And without her and Dr. Wang, I would be in trouble, no doubt. But it started in 1999. I was taking a drug called allopurinol for gout. And it was a common drug that a lot of people take. But in my system, it built up and became toxic. And I'm not only here to promote Dr. Wang and his staff, but also I want to make the awareness of how serious medications can be if you have an allergic reaction to it. I continued taking this, and it developed into an illness called Stevens-Johnson syndrome. And it's basically an immune disorder, and if you continue taking it, basically your immune system starts attacking itself, and then if it continues further, your organs actually start shutting down. But it primarily attacks the eyes and the mucus glands around the eyes. And if my memory serves me right, Dr. Wang may have to verify this, but I think in 1999, I believe I was your second patient to have the amniotic membrane transplant, and to keep from having to remove one of my eyes. And very thankful of that. At that time, he was over the corneal laser division at Vanderbilt. And I was in St. Thomas Hospital under the care of an ophthalmologist, and he kind of threw his hands up and he said, you know, I don't know what to do. He said, I don't know anything about this. He said, we only know one person that has any knowledge at all of Stevens-Johnson syndrome. And I was introduced to Dr. Wang. And without that introduction, I'm sure that I would be totally blind today. I believe I just recently had cataract surgery, I will say that, but before that, there's about every procedure in the book I believe Dr. Wang has performed on me at one time or the other to keep me seeing. But this cataract kind of sneaked up on me. It's over time, you know, it's like looking through wax paper. Everything gets dimmer, and the blues are not as blue and the greens are not as blue, and I realized that something was going wrong, and I contacted Dr. Wang and set it up where I could come. I had the cataract surgery done on March 17th, and the biggest complaint that I've got about the whole thing is now I'm having to not use my glasses. I can actually sit and read the screen of my computer, and by the way, the cataract surgery to me was absolutely painless. I did not feel any pain whatsoever, and like the other gentleman, I could hear Dr. Wang discussing it with another doctor from UT sitting in on the procedure. And when Dr. Wang, before he started the procedure, it gave me reassurance when he leaned down over my shoulder and had a word of prayer. And I just can't say enough for him. I put total 100% confidence in him, his staff. You won't find a more courteous, helpful staff anywhere. And if you've been considering having any type of vision work, I'm talking about just from changing your prescription on eyeglasses to laser, it doesn't care what the procedure is, I would put him at the top of the list. I've got that much confidence in him. I appreciate everything he's done for me, and full confidence in him. So